Weight loss surgery can be life-changing, improving everything from heart health to self-esteem, but it doesn't come without complications. Joining us now to discuss this breakthrough that could change this is Dr. Ghanem from the Orlando Health Weight Loss and Bariatric Surgery Institute. Thanks so much for being here with us today.
Thank you for having me.
So there are many different types of weight loss surgery. Some of them involve stitching things back together internally, and that's kind of where the problems come into play. So there's this new technology, and it involves, of all things, magnets. How do those work, and how did this come about?
Yeah, so if you think about it, when we connect bowel together, we actually have to sew it, or we have to use a machine that is called a stapler.
Right.
And like you mentioned previously, while the complication rate is still very low, it is not without complications at all. And the things that can happen is that those stitches can either come apart or the patient can bleed from the inside from between those stitches. So they came up with this idea that if you really put two magnets together in the bowel and use them to connect the bowel, it'll be safer. Why? Because it's much harder to pull magnets apart. They literally want to find each other. And so that makes the complication number one, which is leak, much less likely. And then also bleeding, because what happens when you bleed, when we were kids and you would fall off the bike, you would apply pressure on that knee, right? So the same thing. The magnets are actually pulling towards each other. They apply constant pressure and they stop bleeds. It really comes into play when we are bypassing part of the bowel, because then we have to connect those two pieces of bowel together. We make a small hole in one piece of bowel, a small hole in the other piece of bowel. We deploy those magnets inside the bowel, and then we just put them together.
Orlando Health was one of a few institutions that were pulled into the clinical trials. So you were on the front lines there, seeing how all this worked, collecting data. What kind of results are you seeing using the magnets?
Yeah, so the results we had were great. We, like you mentioned, we were one of the first few that did it, and we had excellent results, no adverse events. The patients did very well, and most of them, when they passed it, didn't even know that they passed those magnets.
Amazing.
And the patients can even go home in some instances the very same day.
Incredible.
So we went from this, you're staying at the hospital for 1 week, a lot of tubes coming out, to the patients literally gonna go up and walk in, and the most common thing that I hear afterwards is, "Doctor, I'm not even sure you did something on me, because I feel so good."
Music to your ears, right?
I'll take it.
And if you would like more information, you can visit orlandohealth.com/weight loss.